As I've said before, we're taking a balanced approach to public health measures to protect Albertans and prevent our healthcare facilities from being overwhelmed. This includes preparing for what's coming next to Alberta based on what we're seeing in other places. One aspect of these efforts is reducing the duration of isolation requirements for people who are vaccinated. Effective Monday, January the 3rd, people who have previously received at least 2 doses of vaccines and test positive for COVID will be required to isolate for 5 days instead of 10, as long as their symptoms have fully resolved by that time. If symptoms continue past 5 days, then their isolation will need to continue until they are feeling better. For the 5 days following their isolation, these individuals must wear a mask around others at all times when they're outside their home. We feel this is prudent given the evidence that shows that fully immunized people have shorter infectious periods. This change is also in line with the approach Ontario and other provinces are taking and with the latest guidelines from the CDC in the United States. To be clear, anyone who has symptoms must isolate until those symptoms resolve, vaccinated or not, confirmed to have COVID or not. As well, anyone who is unvaccinated must still isolate for 10 days. If your symptoms last longer than 10 days, you must continue to isolate until your symptoms are gone. We're making these changes to help prevent disruptions in Alberta's workforce, especially for those who deliver the services Albertans count on. We believe this step will help balance the need for continuity in the workforce, the well-being of Albertans, and our need to continue to reduce the spread of the Omicron variant. We're providing an exception for workplaces where disruption of service for 24 hours or more would be harmful to the public and where there is no other way to continue the service except by bringing workers back before their isolation period has ended. In these exceptional circumstances, additional public health measures will be required. For example, returning workers would not be allowed to remove their masks when in the same room as anyone else at any time, even if they're distanced. Now, this measure to manage through Omicron is in addition to a number of measures we announced yesterday. As noted by my colleague, the Minister of Education, we decided on extended holiday break for kindergarten to grade 12 students. This announcement included 8.6 million rapid tests and 16.5 million medical-grade masks going to our students and staff starting the week of January the 10th. We've also taken a step I announced just yesterday to improve access to virtual visits to physicians. I am pleased that we were able to work together with the AMA to make this change. We know that many people have avoided getting treatment they need during the pandemic due to being uncomfortable going to a doctor's office or hospital. And certainly, the Omicron variant is not helping the situation. So we're adjusting how physicians can bill for virtual care to improve access while we reduce the chances for the virus to spread. We'll continue to respond with caution, balancing safety with the need for businesses and communities to function. And these changes are in addition to the recent changes to the restriction exemption program and other actions that we took last week, including reducing large gatherings and removing food and drink consumption, limiting interactive activities like dancing, decreasing table capacity, and putting time limits on alcohol service. We're keeping the health measures already in place for gatherings along with masking requirements and expanding the rollout of booster shots and rapid tests. And we'll continue to watch the situation closely and we'll take further action if necessary to protect the healthcare system. So as we mark New Year's Eve tonight, I remind Albertans to continue to please to try to cut your contacts with others by at least 50%. I know this is not the New Year's celebration or the start to the New Year's that any of us wanted, but it's a balanced approach that will help us protect our healthcare system and each other. 2022 brings hope that the end of the pandemic is finally in sight when we get through the Omicron wave, and every Albertan who gets vaccinated is helping to bring it closer. If you haven't received your booster shot, please book your appointment today. Booster shots are available to all Albertans age 18 and older starting 5 months from your second dose. You can book your booster with participating pharmacies and AHS facilities either online at alberta.ca or by dialing 811. Again, I'd like to thank Albertans who have done so much this holiday season by keeping your contacts limited and following the public health measures. And I ask you to please continue to keep doing your part as you celebrate New Year's Eve tonight. Together, we can reduce the spread of COVID and keep each other safe and healthy. Thank you. And now I'd like to turn it over to Dr. Hinshaw for some remarks.
Thank you, Minister, and good morning, everyone. I'd like to begin today's update with a reminder that we do not have new data available today. As I said last week, we have adjusted our reporting over the holidays as a way to give our teams some much-needed time off, while still providing 2 media availabilities and case numbers 3 times this week to keep Albertans informed. Other provinces have also reduced reporting or are following a similar holiday schedule. It has, of course, been a very long 2 years for everyone. A full numbers update for December 23rd to 28th was posted online Wednesday, and estimates were provided yesterday afternoon. We will resume regular reporting, including a day-by-day breakdown for today to January 3rd on Tuesday. As of yesterday, we had about 21,000 active cases of COVID-19 in the province that we know about. As has been true throughout the pandemic, the total number of new and active cases in the province is greater than those figures, and this has been further changed by our necessary recent adjustment to testing protocols, similar to other provinces coping with extraordinary volumes of cases. This isn't new. From the beginning of the pandemic, daily numbers have only given us a snapshot of the situation. They've shown us proportionality and trends, what areas of the province are experiencing surges in cases, for example. This information provides evidence that has allowed us to make and measure decisions, but daily case numbers have never been an exact count. They have never included those Albertans who choose not to get tested because their symptoms are so mild or because they're non-existent and they're not aware they have the virus. In previous waves of the pandemic, we believe our PCR testing program captured about 1 in 4 cases of COVID-19. In the 4th wave, that changed to about 1 in 6. As more individuals who are symptomatic or have been exposed to the virus test themselves at home with rapid antigen tests, that ratio is dropping even more with the Omicron variant. Fortunately, we have additional monitoring tools to help us gauge the level of transmission, including leading indicators like wastewater surveillance and syndromic surveillance, and lagging indicators such as serology sampling. In addition, we are still able to monitor severe outcomes due to COVID-19 with no change. We have also had real-time data emerging from around the world as other countries and other provinces are experiencing the Omicron variant in several weeks ahead of us. As we adjust our testing approach, it is important to remember why we do testing in the first place. Testing for infectious diseases has several purposes. First, and most importantly, it helps plan treatments for those who are infected, and for this reason we must ensure that PCR testing is accessed promptly by those who need it for clinical care. Second, it helps to identify and manage outbreaks in high-risk settings where infections are most likely to cause severe outcomes, like acute care and continuing care. We must maintain timely access to testing in those locations as well. Third, testing helps us with surveillance and monitoring, which does not require diagnosis of all cases. We have been testing more broadly for COVID-19 than for any other infection we have ever dealt with, but this was primarily due to the initial pandemic response goal of containing spread of the virus by individual case and contact efforts. We do not need to document the majority of cases in order to have an effective surveillance system, and we are adjusting to the new testing approach. Finally, as I mentioned, the 4th reason for broad testing was most applicable early in the pandemic when managing spread of the virus by identifying as many cases as possible and their contacts was one of the only ways we had to minimize COVID's impact. We're in a very different place right now with respect to COVID. We have vaccines that are extremely effective at preventing severe outcomes. And we are currently facing a variant that is so infectious and spreads so quickly that individual case and contact management will not be effective. We must use proactive approaches rather than reactive ones. We will continue to watch all of our metrics to help get a well-rounded view of Omicron in the coming days and weeks. While we continue to learn more about this variant, what we do know is that Omicron is spreading far more quickly than any variant we have ever experienced. With more people being infected and in a very short time, that poses a significant potential threat to our healthcare system. Even though it seems that a smaller percentage of cases are requiring acute care, we can expect that with a greater number of people infected, that will soon translate into a greater number of people in hospital. How high these numbers will get is still not known. We've had the benefit of seeing the variant play out in other countries first. What we can learn from them is that while 2 doses of vaccine still provide good protection against severe outcomes, a 3rd dose improves even more. In addition, a 3rd dose provides much better protection against infection. In countries like the UK and Denmark, where Omicron is spreading widely, their early reports of health system impact indicate that hospital and ICU admissions are not rising as quickly as in previous waves. This is encouraging but not conclusive. It is still too early to know the full impact of Omicron, even in those other countries. It's also important to note that in both of those countries, their booster program has reached more than 40% of their population, while we are still around 20%. I urge everyone to get their 3rd dose as soon as possible with whatever vaccine is available to you. I want to speak specifically about the Moderna vaccine and mixing different vaccine types. Data from the UK show that in those with a primary series of Pfizer vaccine, having a Moderna booster resulted in higher and longer lasting levels of protection than a Pfizer booster. I'm hearing reports that some people wish to wait for Pfizer to be available, and while I understand a wish to have the same vaccine, we do not have enough Pfizer right now for people to pick this vaccine and get a timely 3rd dose. Please take the vaccine that is available to you soonest. For those who are under 30, there is a slightly increased risk of myocarditis with a 2nd dose of Moderna over Pfizer. We don't yet know if this will hold for the 3rd dose, so while it is recommended that Pfizer can be the 3rd dose option for those under 30, if individuals wish to choose Moderna, they are able to do so. If you get Moderna, you can be confident that this booster is giving you the best protection available. Getting every dose of vaccine you are eligible for is an important way to slow the growth of Omicron and to mitigate the risk to our healthcare system and to Albertans. It is also critically important to limit in-person contact with others and follow all measures currently in place. I say this knowing that today is New Year's Eve, and tonight and over the weekend, many people are planning to gather with family and friends to ring in what we hope will be a much better year. I know we are all so tired of COVID. Many of us hoped that last New Year's Eve would be the last celebration we would have to put on hold because of the virus. Unfortunately, COVID doesn't care about our celebrations, and it doesn't care that we miss getting together with family and friends. Our best defense right now is to keep our social interactions small, because wherever COVID has the chance to spread, it will. We need to limit our gatherings or postpone them altogether. I know this is difficult. This year, restrictions do allow for us to go out with friends or gather indoors to celebrate the new year, but they require us to do so in a limited way. If going out to a restaurant or party in a hall or other venue, all restrictions must be followed. Please keep groups small. Wear your mask when you're not at a table and when you're not eating and drinking, and very importantly, if you feel even slightly ill, please stay home. If you're going to an indoor social gathering, or if you're hosting one yourself, please keep it small, 10 people maximum, and the fewer the better. Ask any guests to stay home if they're feeling ill, and if you're feeling ill yourself, please cancel the gathering. I know that living in Alberta can make it difficult to celebrate outside in the winter, and we've been reminded of this over the past several days. But it looks like the forecast for this weekend may be cooperating with milder temperatures. So if you're able to celebrate New Year's Day outdoors, please do so. You may even find it a welcome relief from being cooped up indoors over the last week or so. Wherever you go and whatever you do, you should anticipate that one or more people present in any location will likely be infectious with Omicron, even if they don't have symptoms. Make decisions and take precautions based on that assumption and the knowledge that action now is critical to preserving our healthcare system in the coming month. Even though this is not the way any of us want to celebrate the new year, there is still hope. Over the last year, Albertans have demonstrated their strength and resilience and determination to end this pandemic. Most of us have gotten 2 doses of vaccine, and many are now getting the booster. Children 5 to 11 now have vaccine available to them and are getting their first doses, with second doses coming soon. That commitment to doing the right thing is what gives me hope for the year ahead. We must continue to do what's right for us and for our communities, to work together so we can truly enjoy a start to a brand new year. Thank you, and we're happy to take questions.
Thanks, Dr. Hinshaw and Minister Copping in Calgary. We'll go to the phones right away, but a reminder first, if we don't get to you, you can follow up with us separately offline as always. So we'll go to the phones. First caller, please.
Thank you. The first question is from Emma Graney, Globe and Mail.
Yeah, g'day, Dr. Hinshaw and Minister Copping. Thanks for taking my question. Happy New Year to you both. First question here on the shorter isolation period. Are we just talking healthcare workers here, or are we talking other workers that would be deemed essential, such as energy, grocery store, and those kinds of things? And did you hear from businesses to make that decision, or how did that come about?
So I can start off answering the question, and maybe Dr. Hinshaw, you can add. So again, we're providing flexibility for first the 10 days to the 5 days applies generally. We are providing additional flexibility for certain employers who are providing essential services, and they can't replace an individual who perhaps within that isolation period can't be able to provide the service, the flexibility, but they actually have to put other measures in place to do that. And it's really important for essential services, and we're asking employers to take a look at that, as well as, so they'll make the decision based on essential services and guidance with the CMOH, but as well they'll need to put additional measures in place. But Dr. Hinshaw, if you'd like to elaborate on that, please.
Sure. Thanks, Minister Copping. So as you said, the change to a 5-day isolation period for fully immunized individuals, as long as symptoms have resolved by 5 days, is applicable across the entire province for anyone. So that change is based on the evidence that those who are fully immunized shed virus for a shorter amount of time if they have a breakthrough infection, as well as the analysis that shows that if we can have more people complying with that isolation period, and we know that shorter isolation periods are easier to comply with than longer ones. So the more people who comply with that isolation period, the better off we'll be, and that can actually have an overall improved effect on limiting spread. The second piece is, of course, the discretionary approach that is limited only to those in industries or services where disruption of that service causes a significant public health impact. So that could be something like a water treatment plant, it could be healthcare, it could be another service or location where a disruption could, again, significantly impair public health or safety. Those exceptions we anticipate will be less likely to be needed given the universal 5-day isolation period. However, there could be instances where a particular critical service does need to bring some people back earlier than that time period. And if so, again, there will be very specific rules laid out for additional precautions and what kinds of criteria that those businesses will have to meet. And all of that detail will be available on Monday.
Thanks, Dr. Hinshaw. A follow-up, Emma?
Yeah, I do actually. I just wanted to switch over to this boosters. You mentioned that we're at 20% take-up of the third booster shot here in Alberta. Is that pace quick enough for your liking regarding the fifth wave? Obviously, we've got a lot of cases here. And are we seeing all the slots being booked as they come up? Are they being left empty? What does that actually look like right now? Thanks.
Well, thanks for the question. So I'll start and ask Dr. Hinshaw if there's anything further she wishes to add. So we're continuing to expand our capacity. rapid flow-through clinics. AHS has established one in Edmonton, one in Red Deer, bookings available in Calgary next week. We have supply for third doses, a significant supply of Moderna. So that's why Dr. Hinshaw, asked all Albertans to consider that. And actually, my understanding is that there have been some studies which actually suggest that Moderna is very effective, particularly as a booster shot. And we're getting additional supplies of Pfizer coming in as well. When we compare ourselves against other provinces, we seem to be doing well in terms of increasing boosters. But we urge all Albertans that haven't done that yet to go book it and get their booster shots. Pleased to see that particularly those who are older, where we opened that up earlier in December, like for example, groups age 65, 69, over 50%. Over 60% of that age group has actually got the shot. So we encourage them to actually increase that even further. And we ask all Albertans right now to make a booking and get that booster, because that is one of the best ways that we can actually slow down the spread, because we know a third booster is very effective against the Omicron in terms of from getting it. But 2 doses as well are effective against severe outcomes. So asking all Albertans to get the booster shot. And Dr. Hinshaw, do you have any further to add?
I think the one additional piece would just be to let Albertans know that there are different ways to access boosters. So as Minister Copping mentioned, there's more appointments coming online, and people can check regularly the Alberta vaccine booking system to see if there are new appointments that have been added, for example, through the rapid throughput clinics. In addition, many pharmacies still have walk-in appointments available. So if you're finding it challenging to book a timely dose, then you can certainly try walking into a nearby pharmacy, as there still are slots available through walk-ins.
Thanks for that. So we'll go to the next question, please.
Thank you, Tyler Dawson, National Post.
Thanks for taking my question. I just wanted to ask about the rapid test rollout. It seems like they're pretty scarce these days. I'm wondering if you have an update on when pharmacies and whatnot will be receiving more of those test kits.
Yeah, we will get to the detailed numbers shortly. I'll ask the department to do that. We have focused on getting additional tests. We've asked the federal government for 10 million tests monthly, January, February, and March. We've also just procured directly an additional 10 million tests. We received a portion of that this week, and then over the next 2 weeks or next 3 weeks, we'll receive the remainder. And we're actually looking at procuring more tests. So I urge you to department. We can reach out to you in terms of the details, in terms of the rollouts. We have more coming. We're getting them out as quickly as we can, and urge all Albertans to sort of check on the website to see what's closest to you and pick up a rapid test as soon as you're able.
Thanks, Minister. Tyler, we'll follow up with numbers for you separately. Follow up?
Yeah, the booster doses, at what point, if any, are you going to change the definition of fully immunized to 3 doses instead of 2?
Yeah, so at this point in time, we're looking fully immunized is still 2 doses, and that's what we're actually maintaining. We may have to consider that down the road, but again, we're trying. We're monitoring Omicron and what the impact it may have on the healthcare system. That's very concerning. We're being cautious, and so we'll continue to do that assessment as we go forward here.
Thanks, Minister. So we'll move to the next question, please.
Thank you, Jeremy Thompson, CTV.
Hi there. Question for Dr. Hinshaw. You spoke already a little bit about the testing and sort of how the use of it has changed as the pandemic has progressed here, but still wondering about sort of the current testing capacity. We've seen that the highest testing numbers last week were only about half as high as we were testing about this time last year. And actually, one of our reporters was trying to book a test yesterday, and he got a message that told him, based on his location or appointment volume, that online booking was was not available for him at that time. So I just, what's going on with our testing capacity?
It's important to remember that there are two aspects to testing capacity. The first is the swabbing capacity. So in terms of the ability for people to get that appointment through one of the assessment centres to get the swab taken. And we know right now that Omicron is spreading differentially in the province. I expect that within the next week we will see widespread transmission across the entire province. However, as has been common with previous waves, we have seen the initial spread focused in cities. And so in Edmonton and Calgary, where we are seeing the earliest uptick in numbers, there is significant pressure on those assessment centres and having people able to access swabbing as quickly as they were able to access it before. So that is something that we've been working very hard with Alberta Health Services on, but ultimately there is a significant demand for healthcare workers to provide vaccinations, to work in acute care, to do other types of tasks. And so trying to maximize the ability to get those swabs done in a timely way, while at the same time, again, having to partly limit that demand by encouraging people who have symptoms to take a rapid test and to use a positive result as confirmation unless they do have those medical conditions. So again, right now, one of the main pressures is on the ability to have those swabs taken because we do have differential pressures in different parts of the province. In addition, our lab capacity, we have been able in the past to surge to about 18 or 20,000 tests per day in the lab, but that is not something that can be managed as a regular volume. Lab staff, as all of our healthcare teams, have been working tirelessly, and we cannot ask them to do the kinds of extraordinary work they've previously done, especially because, quite frankly, individual case and contact management at this point in time will not be our most effective tool against this particular variant. And so we are utilizing our capacity, which again, is both in the assessment centre swabbing area as well as the lab area, to focus on those locations and individuals who have the highest need for getting a quick result. And again, that is very similar to most other provinces who are dealing with the same kind of pressures.
Thanks for that. Follow-up, Jeremy?
Yeah, just with this Omicron variant, Dr. Hinshaw, you once advised Albertans that it was time to upgrade their masks because this is so much more contagious. It's airborne. So I'm wondering why healthcare workers in hospitals and testing sites are not required right now to wear N95s or KN95s. In fact, lots are still wearing surgical masks and face shields. And we've even heard stories of Albertans entering a hospital or a testing site, and they got to get a new mask, often a surgical mask, even if they're already wearing a much higher quality mask, like in N95. N95s are obviously more expensive, so there's some allegations out there that you're putting money over the health of nurses and other AHS staff. How do you respond to that?
I personally don't set the infection control protocols for different work sites. However, what I do know is that there is good evidence that a well-fitting, high-quality medical mask, along with other aspects of PPE, as a part of universal precautions, is effective. It's my understanding that the approach to PPE use in some settings, so for example in wards caring for COVID patients, that the recommendation is now to use N95 masks in those locations. However, N95 masks also come with greater discomfort and can cause some challenges when wearing them for long periods of time. So I think it's really important when we look at the evidence to use the overall approach that is most appropriate to the context and to use N95 masks where they will be most effective, but to still enable the use of well-fitting, high-quality medical surgical masks in places where they will provide the greatest benefit on that balance of the risks and benefits of all different types of PPE.
Thanks for that. We'll go to the next question.
Thank you. Michael King, Global News.
For Dr. Hinshaw, what feedback or evidence shows that people who maybe won't comply with a 10-day quarantine will now comply with 5 days?
We know that throughout the pandemic, there have been a range of responses to the public health measures. And what we've looked at in collaboration with other provinces is the differential impacts of different lengths of quarantine, isolation. So the studies, we don't have randomized controlled trials that indicate that people would be more likely to comply with 5 versus 10 days. But we do know that the ability for people to successfully complete a shorter isolation is enhanced when we inform them that we're doing that based on the evidence of shortened viral shedding periods in those who are fully immunized. So I want to be clear that the decision to shorten the period of isolation is based on the science that shows that full immunization does limit the duration of infectiousness. And it also is based on, again, the assessment of different types of impacts. So if we felt that the viral shedding was not impacted, this would not be the appropriate course of action to take. However, because we do have that evidence to show that shorter shedding period, we are requiring that people do wear a high-quality mask for the duration of that 10-day period, and that this aligns with the changes in other jurisdictions. That, in my opinion, this is the best balance of, again, benefits and harms, looking at all of our possible options. And we also know that there are significant harms if essential services are disrupted, as we anticipate will be happening due to the current surge of cases.
Follow-up, Michael?
Yeah, just wondering if we could get an update on booster shots, 12 to 17-year-olds, when that's coming into play.
It's my understanding that we will get some advice from our advisory committees on that in the new year. And so we are looking to the National Advisory Committee as well as our own Alberta Advisory Committee for advice on that particular age group.
Thanks, Dr. Hinshaw. I think we'll take time for 2 more callers. I think we have just 2 left on the line, in fact. So we'll take the second last call.
Carly Robinson, City News, Edmonton.
Hi, thanks for taking my question. I'd like to start with the minister, and if Dr. Hinshaw would like to supplement afterwards. We're hearing that we're only catching, with data from the Delta wave, 1 in 6 cases, but it's probably higher with Omicron and at-home testing. So basic math here shows that Alberta currently has at least 126 active COVID-19 cases. Yesterday was our highest day of recorded cases on record. But today there's no new restrictions. I was hoping you could explain what Cabinet's logic was in this move.
Well, thanks for the question. As you know, Omicron is challenging all provinces across the country and a number of jurisdictions around the world, and we're using largely the same tools to manage it. It's just the timing may be different in different circumstances based on what the provinces or that jurisdiction is seeing. So, for example, here in Alberta, as you know, when it came to restrictions to manage the spread, we never really, with a few minor modifications, coming out of the 4th wave, we never really changed those restrictions. And in addition, on December 24th, a number of new restrictions came into effect to manage the spread, and we're watching those very closely. But we've also taken other actions, like we've seen in other jurisdictions, in regards to rapid antigen tests. Also looking at increasing booster shots, and even just this week, we've taken another number of measures to help manage through that. The announcement we made today in terms of move from 10 to 5 days in regards to isolation. We announced yesterday, my colleague announced in terms of postponing opening of schools, so we can, that will have an impact in reducing the spread, very similar to what other provinces have done. In addition, by putting mask and rapid antigen tests in the schools, that will continue to help manage the spread. And as well, even just the change that we made in terms of access to family physicians. So we are actively looking at different ways we can manage through this. We're using the same tools that we see across the entire country that are being used by different provinces, maybe slightly different approach, but generally in the main, we are broadly using the same approach. And as indicated in my remarks, we are watching this very closely, and if we need to take more measures, we will.
Thanks, Minister. Follow-up, Carly?
I was just hoping to get Dr. Hinshaw's perspective on that same question and that number of how many active cases are estimated right now, but also on, are we staying with the restriction exemption program with all the new stuff we're learning about Omicron, with its incubation period being shorter, so a test 72 hours ago might be out of date, as well as 2 doses of the vaccine not being as effective as 3. Just sort of reacting to all of those things and how we're staying the course now, I guess.
It's the role of elected officials to make decisions about pandemic management, and it would not be appropriate for me to comment on their decisions.
Thanks for that, Dr. Hinshaw. I guess we've had a bunch more reporters join the queue. I'm sorry we will not be able to get to everyone today. Please do follow up separately if there's anything specific we can answer for you. So we'll go to the last call right now.
Tricia Kindleman, CBC.
Good morning. Thanks so much. Dr. Hinshaw, just kind of expanding off of that last question. We heard this return to school delayed yesterday and then the shortened isolation period today. I'm just wondering if there might be, this could be leading to some confusion. It seems like these two steps could almost work against each other if community spread isn't mitigated. Are you worried it could just end up in schools a week later?
We need to anticipate that Omicron will be in every aspect of our society in the next several weeks. As I mentioned earlier, we should all anticipate that wherever we go outside of our own homes, there's somebody there who's infectious with Omicron. This is spreading farther and faster than anything we've ever seen before. And a portion of our pandemic plan is related to the measures that we need to take to preserve essential services and to keep a kind of foundational structures functioning. So we do need to look at trade-offs, and we do need to make sure that what we're doing is minimizing the chance that people are out in public during their highest infectious periods, which is why I want to emphasize again that anyone who has symptoms, even if they have a negative test, whether that's a PCR test or a rapid test, anyone who has symptoms should be staying home and away from others. And having that 5-day isolation period targets the highest infectious period, followed by the mask wearing, which will minimize the chance of onward spread. But we will not stop Omicron. It is not possible. All we can do is slow it down, and that is exactly why we need to be taking these precautions everywhere we go. We should be anticipating that we will all be exposed to Omicron at some point in the next several months. And we need to remember those regular daily precautions and follow the basics with rigor, because that will be what stands us in best stead.
Thanks for that. Follow-up?
Yes, thank you. You touched on the essential services there and mitigating the expected disruption. But can you give us any idea about what the projections might look like for those potential expected disruptions?
Part of it depends on how quickly, again, the virus spreads, and that's something that, again, we can all help to mitigate. So I don't have projections of service disruptions that I would be able to comment on. But what we know, based on what other countries have experienced, is that we should expect that Omicron continues to spread widely for the next several weeks at minimum. And again, the important thing is that if all of us are following the basic precautions rigorously every day, we can help slow that spread. And that is the most important thing that we can do right now.
Thanks for that, Dr. Hinshaw and Minister Copping. So we'll wrap it up there. Thanks, everyone.